Okay, so the first thing I'm going to do is ask certain people in the room to please come up, because this is really a landmark for the department and for the team that's been putting together these boot camps. Is I think we've learned a lot along the way, and we've worked pretty hard to pull this together. And while we have the photographer here, I'd like to ask Ed Kalpas, Matt, Kimon, Tammy, Joe, Bridge. Eric is not here. Who else am I missing? Is Valerie here? She's been absolutely amazing.
At the registration desk.
Okay, well, let's get Valerie up here for a photograph, please.
Did you guys want to have the signage in it?
No, let's just do
Afterwards,
it.
that's
Yeah, we
fine.
can do it. Let's just do this quickly so that we have some.
We're missing
Ed
Matt.
is coming. Matt is right
Oh,
beside you.
thanks.
Okay, and Bridge is here. Am I missing anybody? Okay. Whoops, I'm gonna.
Sorry for the group photo.
It's okay. It's the only time we have the photographer here. So, okay.
Come over on this side. And
And let's do it quickly.
Ready?
Yeah. Good.
Good. Hands down at your side. Good.
Valerie's coming.
Hands out of your pocket.
Okay. Let's.
Take a picture of it. I'll put the photo.
Valerie, keep coming, don't worry.
Good. Okay. Oh, here she is. Come on, Valerie.
Put her right in between here. Make space.
Yep.
Come this way.
Come this
Right
way.
there. We have a professional photographer.
Oh,
Everyone-
yeah. We gotta.
Oh, yep. And come over here so you're not in the back. Okay? Come in between. Make space for him. Anywhere. There. Right here. One more.
Okay.
Ready? Okay. Come in close. Step forward. 1, 2, 3. Good. Smile.
Thank you. Okay. Thank you for your patience, as they say on airlines when they've kept you for 4 hours without food or drink on the ground. So welcome, everybody, and thank you so much for coming today. Today, the whole concept is to talk about data, and I think that from Kathy's first introduction, you understand that there's a lot of it, and it's very hard to get your hands on it. It seems very simple. The concepts are brain dead simple, but the data has to be cleaned, mapped, curated, and put in forms that you can use, which is why we today have Trinetics here to talk to us about what they've done to help us with this problem. But as we go forward, now will that bring, yes. We can see that trying to remember everything and data is a very age-old problem. As soon as people stopped living a very simple agrarian life, all of a sudden they had things to keep track of. And they had to codify this in some way and figure out, how do I remember this? It's too much for me to remember everything. So this is an early database that we have in front of us. And perhaps you can get the data in. It's not always going to be that easy to get the data out. Say you're in another town, what do you do? But really the concept and the issues of information storage and retrieval have been around for a very long time. So today I'm just going to review with you briefly the plan for the day. And we hope that all of you will be here all day, but if you have to leave, don't leave during any of the good talks, which is all of them. So we've already heard from Kathy, who was kind enough to come and talk to us. I am here, I'm Mary, and this is my time slot. And then Dave Cyril, who's the Director of Research Services for Stony Brook Medicine IT, is going to be leading a session that I think is very interesting, talking about, first of all, sort of a high-level view of what is research IT at Stony Brook, and within that, he's going to highlight a couple of things with speakers from his group. Then we have a break. There is coffee up there, first come, first serve. There's not a lot, but you feel free at any time to grab a cup. We'll have a break. And then this is, I think, for most people who are interested in doing any kind of quality improvement projects or any kind of clinical research, understanding the IRB process is important. And it's sort of like a black box, except it isn't. There are real people who sit in the IRB office and consider very carefully, what are you going to do? And they will talk to you about this, but there are different rules for different types of studies, and de-identified data can be handled by different rules than patient-identified data. But what does de-identified mean? And that's not as simple as you think. And how do you go through the IRB process? So Amy and Luann were kind enough to come and talk to us today about this. There are at least 2 members of the IRB in this room. I know, I'm one. That's what then the Trinetics presentation, they're going to talk to us a little bit about what Trinetics is and what it can do for us. And we're then going to give you some pizza to eat. And we're going to we've had a contest, and we're going to announce the winners of the contest, and those lucky people are going to have Starbucks gift cards in a very small denomination. And after that, Cerner is going to come and talk to us. Cerner Research is coming, and they are really, it's interesting because there's several EHR vendors, and Cerner is sort of second, I think, to Epic. People love Epic much more than they like Cerner. The users, the end users prefer it most of the time when you talk to people. This is not a statement of fact, it's just my observation. But what's interesting about Cerner is really very interested in research and cutting edge and using data and mathematics and algorithms and interesting approaches to things, more so than Epic, which is perhaps more user-friendly, but the strength of Cerner is in Cerner Research, and they're flying out from Kansas City today to speak to us. So that's kind of exciting as well. And then we're bringing back Jim Murray. Some of you may remember him. He was our CIO before Kathy, and he's been in a lot of places and some very excellent academic places, and he's going to talk a little bit about how he sees the challenges and problems facing hospital IT and beyond the hospital IT today. Then we'll have a little bit of a wrap-up session. So some housekeeping, as I said, there's coffee around the corner. Power strips are intermittently available. If you need to charge your computer or devices and you're not sitting near a power strip, please swap with someone who is. This space was a little bit challenging since there are no outlets anywhere, so we had to kind of make do with some power strips. And also be careful not to trip on them, please. As I said, we're going to be having pizza, and these lectures are going to be recorded and will be available on the BMI website for those of you who would like to use them, share them, listen to them again, refresh a point, whatever you would like, we will have those available. So just talking to all of you, how many in the room are physicians? How many are PhDs? And, okay, that's very interesting. Do we have any students? A smattering of students. And so what have I missed? Somebody tell me something I haven't said. IT.
How many of you guys are clinical researchers or just clinical researchers first? Basic science researchers?
Okay, and coordinators? So that's a very diverse group, somewhat physician heavy, which is interesting. And how many people are from Stony Brook? How many people are not from Stony Brook? 1, 2. So that we've gotten a few people from outside. That's very interesting, and welcome. I hope you enjoy your time at Stony Brook today. So I wanted to talk a little bit. I know you all got these bios, but Dave Cyril is really an outstanding resource for all of you who are interested in doing any kind of research using data at Stony Brook. He's not only extremely qualified, he's really nice and will help you, which is more than many people will do. Dave follows through, and Dave understands the entire process of data at Stony Brook, how to get it and what to do with it. And I think as we put in place some governance around what projects will be supported and which won't be supported, it will be very helpful, because that way you aren't sort of standing like a hungry animal begging for support, but rather you can structure things so that support is available for you and appropriately. And then, as I said, we've got our folks from the IRB. We have a group from Trinetics to help show us, and I won't talk about that, I'll leave that up to them. Jim, and then the chair of the department, Dr. Joel Saltz, will be doing the wrap-up. We had a great team of people helping us put this together, and that, I'm sorry about the photographs, but it was really a special group, and we worked very hard to be here today. So why are we here? I mean, clinical informatics is a data-driven specialty, and it crosses many, many types of healthcare. It goes from health systems, population health, the EMR. It helps us, data helps us drive quality. It drives hospital finance. It's important to education. As we spoke about a little bit earlier, the upcoming world is telehealth, which generates huge amounts of data, not just sensor data, but videos, and it's a huge amount of data. How do we use that? How do we leverage all of that data? What about sensors? So this is clinical informatics across all of these spectrum. Biomedical informatics is an even broader specialty, but clinical informatics really deals with the intersection of computing, data, and medicine. So here at Stony Brook, this is sort of punishment for coming. You're going to have to listen to me talk a little bit about what programs do we have here at Stony Brook. And some of you might be interested actually in looking into studying further informatics. And we have biomedical informatics. We have 2 tracks, which are clinical informatics and bioinformatics. These graduate programs are based in East and West Campus. The department has a foot in both East and West Campus. It's unusual in that regard and is quite analytic and extremely computational, mathematical, biomedical informatics department, more than many. There are 3 levels of education degrees or certificates that can be awarded. You can take some classes and get a formal certificate in informatics, which is kind of a nice calling card if you are interested in the field but don't really have the commitment at the moment to get a master's degree. And then, of course, there's a PhD level diploma granted as well. Clinical informatics, I'll talk about a little bit more, the fellowship. You can be, I hate to say grandfathered in because someone will say I should say grandmothered in, but that sounds awful. So I'll say grandfathered into board eligibility. And we have 2 fellows here actually at the moment. Rao is here, Anne I don't see here today, but for the last 2 years the department has accepted, in conjunction with pathology, a single fellow per year. They are not at the moment part of the Acgme certified fellowship, but I'll talk about that in a minute. And then the other opportunity, and I'm glad to see Pat here in the audience, is that the School of Nursing is launching a PhD program. And Stony Brook Nursing PhD program wants to establish themselves as the premier scientific, hypothesis-driven, research-driven PhD program on Long Island. And I think we will be very happy partnering with them to work and perhaps grant sort of joint degrees in biomedical informatics and nursing through the School of Nursing, but doing joint projects and PhD work together. So I'm glad Pat's nodding, so I haven't said anything too terrible. But I do think that, and across other schools as well, we have the School of Social Work, well, it's not quite, but the Department of School of Social Work, we have public health, and working across interdisciplinary fields is very interesting and very important. There's actually a new field called Computational Epidemiology, which is fascinating. It's population health, and we're and looking at disease distributions, comorbidities, and we're doing a very interesting project here with Fusheng Wang and his graduate students, and Eleanor Schoenfeld, who's an epidemiologist, and working with a whole team of people to look at opioids and opioid distribution and across New York State, and specifically in Suffolk and Nassau County. And it's really, really interesting that you can use Sparks data, which we won't talk about today, but it's a very interesting data set that's collected by the state of New York, that every patient who comes into any hospital or emergency room is recorded. The hospitals are mandated to send this information, and it's rather granular. You have the patient's name, age, sex, ethnicity, race, comorbidities, their diagnoses, their insurance, whether they're discharged to home, discharged disposition. So it's a very rich data set. And this group, our group, has access to the identified Sparks data. So it's very interesting that you can track a lot of information looking at this. So it's a very exciting field, and it's data-driven as it relates to patients. Now, just another moment for those of you who might be interested in the Acgme Fellowship. It will be starting here, all being well, 2019, I believe. And concurrent with that, you can still be grandfathered in for hands-on experience in informatics. So some of the physicians who are interested in working in informatics might want to consider targeting their work so that they can sit for the board exam. Because as you know, once a board exam exists, it kind of creates its own demand to be board certified in order to work in the field. So that's coming. It's not here yet. Many informaticians, clinical informaticians, physicians are not certified at the moment, but going forward, I think it will be very important.
What's going to be the lead board for that?
It's through preventive medicine and pathology. If you're a pathologist, you must take, it's the same exam, but you must register for it, and the paperwork is handled through the American Board of Pathology. But otherwise, it's preventive medicine. And starting at Stony Brook, we have commitment from the dean to support 2 fellows a year. So that's a total of 4 fellows. So that really will drive a lot of clinical research. They have to do clinical research as part of the fellowship, and that's very exciting because those physicians will be a liaison to this entire group for interesting projects, for helping with data, and all of those things. And you must be a board-certified physician in some specialty and not have let your certification lapse, which means actually that there are a fair number of people working in informatics across the country who they didn't do what do you call it when you have to recertification. They let their recertification lapse, and so they are not eligible for the board exam in informatics, which is kind of sad. Here in the department, we're doing some outreach to try and bring the word of what is informatics to Stony Brook. And there are 2 non-degree granting efforts that are really open for everyone. One is our new inaugural, just started Grand Rounds. Dr. Duong was our inaugural speaker, but he got upstaged by the most recent snowstorm, unfortunately, but he's here in the audience today. And these boot camps, we've put on 3, this is going to be an ongoing series with some repeat topics, but a new flavor each time. And they will continue to be standalone so that if you miss one, you don't have to not go to the next one. The Grand Rounds are being led by Janos. They will be weekly during the academic year. They're on Wednesdays from 3 to 4 p.m. in the Atkins Conference Center. We will be granting 1 hour of CME for these. This has a dual purpose. They are also part of an ongoing graduate series for the biomedical informatics graduate students. And we have 4 really main areas of focus in this lecture series. Dr. Duong is in charge of the imaging informatics. Dr. Richard Moffat, one of the faculty members also in biomedical informatics, is broadly in charge of the genetics and the informatics flavor of computational genetics. I'm lining up speakers for the clinical informatics sessions, and Jonas Almeida who is the leader of Tech Innovations, is going to be looking at speakers to tell us what is the very latest thing in the field technically. And Jonas is giving next week's grand rounds. Now notice that this is not going to be in the Atkins Conference Center. It was the one day we couldn't get the room, but we would love for you to attend. I think they will be interesting talks, some of them perhaps more to your liking than others. So if you please put this on your radar and come and hear us speak. We're having people come from outside speakers. We've got a fabulous guy coming from CHOP who's going to be talking on alert fatigue and how you can look at sensitivity and specificity of rarity of disease, positive predictive value in assessing alerts in the EMR. He's a great speaker, so when he's here, you really ought to come hear him. He's outstanding. Bimal Desai, fabulous guy. So just to review our first boot camp, you can see we covered some of the basics for the Clinical Informatics Board, leadership, management, what is informatics, all of those things. And you can see that our graphics definitely got better. We've added color for the second boot camp, so that was exciting. And we had people here, again, some of the things that I selfishly wanted to review because they were going to be on my exam. I had structured some of the lectures around that, sensitivity, specificity, all of those things that we think we understand as physicians, but you forget. Well, I forget. I mean, I've studied sensitivity and specificity maybe 50 times, but how does that translate into a test? What does it mean? All of those things are kind of important to review, and we don't always think about it every day. And so here today, we have our final agenda, our final flyer, and it hasn't changed much since the last one. We didn't change the graphics at all, but I think we've learned a few things. And going forward, we're hoping to be able to do this in the city and reach out to people beyond Stony Brook and make it a formal CME granting event where people can register and come from all over the city. So I have about 5 minutes. Now I'm going to show you just a little video, and I think it's interesting. It's sort of data in action. What can we do with data? And this, to give you the background of this, the biomedical informatics department was very involved with the DISRIP effort in looking at who are the patients, where do they come from, what characterizes them, what diseases do they have, where do they live. So this is a very interesting combination of data sources. And I'm only going to show you a small piece of this, but this is integrating Stony Brook readmissions data for the Medicaid population into Google Maps and in real time looking at where these patients come from. So let's see. This doesn't seem to be, it didn't see, Why did that not, is there some reason, Dave, that this would not be animated? There it is, I found it. Okay, so if you look at this map, you can see a hot spot in the middle. You can see that there's a red area. Everybody see that in the middle of the map? It's red. What is that? That is an area, it's a hot spot of Medicaid readmissions, 30-day readmissions to the hospital. So when we looked at the 30-day readmissions to the hospital and the patient's zip code, their address, we were able to get it down to census tract level. That's an area, a census tract, where there were too many readmissions. So now, if you look at this, we're going to zoom in on this and look how much information you can see. You can see that right there, the Oakview apartments are up front center. And right behind them, just above that, there's the Suffolk County Social Services, and yet the two do not meet. There is no way to get from Oakview Apartments to the Suffolk County Social Services. So let's go and look at this. So you can walk on the streets where your patients live and walk right up to the entrance to their apartment complex and go a little closer. You can go even a little bit closer until you can read where it is. And this is called Homestead Village Apartments. Well, now if you Google this, you can get a lot of information. Homestead Village Apartments is the same thing as the other name. They're called this because this is Section 8 housing. And Section 8 housing doesn't really like to advertise, so they have two names for their wonderful apartment complex. And what is really, really interesting yet sad, and very graphic to me, graphically displayed in this example, is that we have a group of patients all living in one small geographic area. We have a problem with those patients. They're coming back to the hospital too often. There's a clinic right there. And actually what I didn't show you was that there's a gun store right across the street from the clinic. So you can really get an awful lot of sense of who are your patients from data. This is a data-driven visualization of who is coming back to the hospital. So with that, I think I've said enough. And what's next? What's next on our agenda? Do we have, is this Dave coming up? Wonderful. Well, with that, I will turn the podium over to Dave, and thanks, everybody.